What we're going to basically look at is treatment dose and also needling techniques. I will apologise because I've not put many images or anything like that. It's mainly going to be more wordage within this presentation as opposed to anything else. But it's more or less trying to get as much information across to you in the short time period in which we've got. So it will take approximately an hour to go through this. I mean, once we've finished, if you've got any questions, then by all means, then, fire away once we get to the end. Could I just ask everybody, if you've got your microphones on, if you could just switch it off so that we don't get disturbed and we can just have a steady flow. All questions can be asked at the end of the presentation. So if we're looking at treatment dose and needling technique, it is important in one respect because this is going to govern how effective your treatment is actually going to be. So there are key things that we'll take a look at. So the main aim and objective, aim to advance your understanding of acupuncture treatment dose. By the end of the actual presentation, you'll have an understanding of what is the optimum needling retention time, the different effects between manual, laser and ischemic compression on treatment outcome, the optimum needle manipulation technique, what is the optimum needling depth, the optimum frequency and number of treatments, what the optimum number of needles to use during a treatment session, and the effects and benefits of using distal points, and also the physiological effect of utilizing the surrounded dragon technique. So in other words, if not utilizing the surrounded dragon technique, I'd say you're missing a very important technique in that respect. So these are key things that if you're not taking much note when you're actually applying a treatment on these factors, then at least it will raise these factors and hopefully bring it to your attention. So therefore you start to apply these within your treatment session. So in acupuncture, the choice of acupoints, methods of stimulation, frequency and number of treatment sessions, number of needles used and treatment time are important factors that needs to be considered concerning treatment outcome. So this is going to be, all this will actually influence how effective your overall treatment is going to be. So in other words, if you're not making any consideration with regards to any of these, then yes, it is going to start to impact your overall treatment in itself. So in other words, it can bring your overall treatment time down. How many treatment sessions is actually going to require to, in other words, resolve a problem. So if we look at needle retention time, so the duration of the needle in the acupuncture point. So in other words, how long is that needle actually is inserted into a particular acupuncture point, not necessarily how long the overall treatment session is. So what's also going to influence it is also, the manipulation. So I always recommend, you go back and do manipulate the needle maybe every 5 or 10 minutes in that respect. So needle retention can be as brief as a few seconds or as long as 20 minutes. And different techniques is going to require different treatments. So again, it all depends as to whether you're treating a muscle or you're actually more focused on the actual acupuncture point in itself. So in other words, if you want to relax a muscle, by just inserting a needle into a muscle will relax it within a few seconds. So it doesn't have to be in for that longer time period. However, if you're wanting a central response from your needling, then it needs to be longer than 20 minutes. And that will give you more of a central response. So all that is going to influence the duration in which you're going to have a needle in place. So if you look at key studies, particularly the one by Napido in 2005, what they were basically doing was assessing a 32-minute treatment time and looking at it from a functional MRI scan to see what effect and what changes takes place during that time period. And what they basically found was after 15 minutes, they found some bold signaling taking place. And then again, it occurred after 8 minutes from the final 32 minutes. So what they advocated, particularly after their second study that they conducted in 2010, what they advocated that needles, ideally, an ideal needling retention time is 20 to 30 minutes, if not longer. So what they're suggesting is, to get the optimum results, you need to be leaving your needles in place for at least 20 to 30 minutes. And it is important to take note of that, because when you look at some studies, there's quite a few studies out there where the needle retention time is only 15 minutes. And depending on what you're treating, 15 minutes might not be enough in order to get a response. Particularly, like I was saying, if you want a central response, the needle needs to be in longer, because it takes longer to obtain a central response. But however, your central response will outperform the time period in which the needle's actually been in. So slow build up, longer effect. Again, if you look at certain other studies, such as where they observed needle retention time of 20 minutes, 40 minutes, and 60 minutes. Again, they found within their studies, your 60 minutes far outperformed your 20 and 40 minutes. And again, your 40 minutes far outperformed your 20 minutes. So what they're demonstrating is the longer the needle's in place, the better. And again, if I look at many of my students that come on our courses, when they're doing their case studies and they send us case studies back to us, one of the main things that I do find from those case studies is the fact that all they've actually changed is they've not made any changes to the points. All they've actually made a change to is the duration of the treatment. And that has made major impacts on the treatment outcome. So again, just changing that simple factor can make big differences. So again, if we look at other studies where they've done an hour up to 6 hours, again, they're finding the longer they was in, the better the treatment outcome. So you can see the difference in regards to that. But as I was explaining beforehand, if you wanted a local response, you can obtain a local response in anything between 10 and 15 minutes. But however, if you're wanting a central response, what you've got to bear in mind is once you insert that needle, it has got to have effect partly on the central nervous system, because you're going to have a lot of nerve bundles and blood vessels in the vicinity of that acupuncture point. Stimulating those nerve bundles, once it gets back to the central nervous system, those part of the brain is now going to become activated. That is time dependent. And then on that, it's going to have an effect either on the hypothalamus, which then has got to affect other areas of the brain. And then the release, let's say, for example, you're dealing with pain, the release of endorphins. Now, for that to take place, you are talking at least 20 minutes onwards. If you do utilizing something like the 4 gates, in that basis, if you've only applied it for 15 minutes, just as it's starting to release the endorphins, you've taken the needles out, and the effect of that will then start to wane off. So you do need to have it in for a set time period, at least 20 minutes, for that to get any full effect. So if we also take into consideration the delayed effect of acupuncture, now this is quite important. And again, when you're looking at studies, it is quite important when you're reading studies to understand that. And I'm finding many people who's undertaking studies, regardless of whether they're fully qualified acupuncturists and how long they've been qualified for, this is something that I'm finding many acupuncturists, regardless of what level they're at, is not aware of the delayed effect of acupuncture. And you'll find many studies are undertaken where they'll apply the acupuncture and assess immediately after, and then saying acupuncture is not effective. However, there's several animal and human studies out there that has actually demonstrated that, the key feature of acupuncture analgesia is its longevity, a delayed onset, gradual peaking, and gradual returning to baseline. Again, a 30-minute acupuncture session, the pain threshold slowly increases, outlasting the treatment. If you look at Price and colleague, found that following electroacupuncture, there is a delayed onset of between 1 to 24 hours to maximum effect, which persists 10 to 14 days. So again, if you're somebody who's applying, you can undertaking some studies and they assess immediately after, then they're not going to really get that effect. As Price has demonstrated, 1 to 24 hours. And that's the delay in that respect. So they're key things that has got to be taken into consideration. If I look at a study I did myself back in 2012 that I published, that was looking at utilising acupuncture, particularly looking at the studies where they were assessing delayed onset muscle soreness. I took a more recent study which I published, I think it was 2023, 2024. Again, that was showing that there was a 3-day delay. Well, not a delay as such, but it was 3 days before you saw acupuncture, the peak effect of acupuncture taking place in comparison to the placebo or the control group. And that's where you saw the biggest difference in the effect of acupuncture. So again, you're talking up to 72 hours for you to start to see that. And again, once you start to bear in mind, once you're looking at delayed onset muscle soreness, that is where it is going to peak during that time period as well. So in other words, you're going to get most of your discomfort coming in during that 3rd day, whereas acupuncture was shown to have a significant effect during that time period. Now, besides acupuncture being used with regards to needling, what you've also got to take into consideration, depending on what you're treating, will also determine as to whether you're going to apply manual acupuncture, laser acupuncture, or you're actually going to apply pressure. Now, so just because, many people who come on any of my courses, I'm teaching you how to needle. But however, it is important to bear in mind is you do not have to needle a point to get your optimum results. And depending on what condition you're treating, sometimes you might be better off applying pressure, or you may well be better off applying laser, or in some cases, electro. But not in all cases, each one's going to outperform the other. It's depending on what the condition is as to what you're actually treating. And different techniques will have a different effect on areas of the brain. Okay, so that's also something to take into consideration. So if we look at the difference between electroacupuncture v manual acupuncture, if you look at the study by Napado and Kong, they found that electroacupuncture was mainly associated with activation of the somatosensory area of the brain, the motor area, brainstem, angulate, or the insula, while manual acupuncture was associated with deactivation of the limbic system and other areas of the actual brain when compared to electroacupuncture. Same again, Huang found that electroacupuncture tends to produce more activation in the central nervous system and less deactivation compared to manual. So again, you're seeing a difference between the systems that's actually being used as to what response you're actually going to get. So again, if you start to make a comparison, if you start looking at muscle strength, for example, Toda in 2011, they investigated and compared the effect of electro and manual acupuncture, mainly looking at the effects on carnitine and glucothione in muscles. And what the basic found was manual acupuncture was far more effective with regards to enhancing muscle strength in comparison to electroacupuncture. Again, that was also shown by Zoe and colleagues in 2012. Again, they found manual acupuncture was more effective at enhancing ankle dorsiflexion muscle strength in comparison to electroacupuncture. Now, a study in which I undertook myself, recently published in 2025, that will be in June, July 2025, when that actually got published. Now, the key thing, what I was looking at there was the utilization of electro and manual acupuncture. Again, once we did the presentation on plantar fasciitis, so I have actually outlined that study within there. But however, I was expecting electroacupuncture to outperform manual, in which case it came up that manual was significantly all around better than electro. But one thing I will say, it depends as to what aspect of the heel you're actually treating. And that's just from clinical experience, is if you're treating mainly the medial tuberosity and actually going into the muscle itself, such as the adductor hallucis or the flexor digitorum brevis, then your manual, which is how most patients are going to present, then your manual will far outperform the electro. However, if you've got a patient that's going to present and the pain is primarily underneath the heel, more bruising of the actual bone itself, then again, your electro in that circumstance will far outperform your manual. So again, it depends as to what you're treating, where you're going to start to see the difference. Again, if I'm treating fractures, if I've applied a manual and it's not healing, that's where the electro is going to come in. And that's where, again, your electro will outperform your manual on that. Again, I have done case studies which I've published on that, where it's demonstrating non-union of the fifth met. And in that circumstance, I've used the electroacupuncture and had, significant effect. A lot of it is going to be down to the frequency as well. So it's not just a case of utilizing the electro, it's what frequency you would actually use to enhance the bone healing. So in other words, if your target is primarily on pain, you are going to get a delay in bone healing, because the frequency, depending on frequency you're actually utilizing, can have an adverse effect on bone. So in other words, if you're trying to enhance bone healing, you cannot be going over 10 hertz. Anything once you start to go over 10 hertz, and once you start to approach 20 hertz and above, it's going to delay the healing of bone. So that's where 10 hertz, between 5 and 10 hertz is going to be an optimum setting in electro for enhancing bone healing. That's going to be important with regards to that. Whereas if you look at manual acupuncture, even if you're manipulating a needle, it will only stimulate up to 4 hertz. So that's the advantage where electro comes in over manual. So if we take comparison between laser acupuncture and manual, again, both of those are going to affect different areas of the brain and also going to have a different treatment outcome. So depending as to what conditions you're treating, in some cases, your laser will outperform your manual. And again, if you're treating myofascial trigger points, your laser will clinical effect size of laser compared to manual, your laser is much greater than manual. And that's something to bear in mind. So once we start talking about myofascial trigger points, particularly when I see colleagues, using all these needling techniques, needling quite deeply into myofascial trigger points, where they could be using 4 safer techniques, and particularly once you're looking at over the torso and using a lot of these fanning techniques over the torso, putting the patient more susceptible to neurothorax, when they could be applying pressure, which has been shown on a clinical effect size to be more effective than manual needling, and also laser, which has an even greater effect on myofascial trigger points. So these are things to bear in mind, once you actually get into any kind of needling, is what's the best technique to actually use, as opposed to just going out there and just needling at all times. So, and again, once you start looking at the two, your manual is going to affect more your C fibers, whereas your laser is going to have a slightly different effect on the actual fibers. So once you start to look at the manual, areas of the brain have a effect on the somatosensory cortex, whereas laser will have more effect on the autonomic nervous system. So key thing there is manual is going to be better for if you're going to be looking at enhancing muscle strength in that respect. So in comparison to laser. And again, once you start to look at laser again, it's actually been shown that laser tend to be associated with ipsilateral brain activation and central deactivation, and the ipsilateral activation was only seen with limbic acupoints and not on the trunk. So you are going to see different aspects of that once you start to look at the trunk. If you are needling on the torso, generally you are going to get a sympathetic response. If you're needling more into the arms, I'd expect to see a sympathetic response, regardless whether it's manual or laser. And that's something that's going to be quite important to understand that, because if you don't take that into consideration, if you're trying to treat somebody with a heart condition, for example, if you're trying to reduce our heart activity or to calm the heart down, say somebody's got bradycardia or tachycardia, then the difference between putting it on the torso or on the trunk. So on the torso, it's going to activate, whereas on the trunk, on the extremities, it's going to reduce activity. So they're key things to bear in mind once you actually start to needle in different areas of the body. It's what response you actually want with regards to that. So there's just key areas to take into consideration, as each one's going to activate different areas. So if you're looking at laser v manual, I would use the main time I tend to use laser is if somebody's presented with more of a psychological issue. I'd use laser over manual. I find it's more calming and it has more of a greater effect if I'm wanting to calm that patient with regards to a psychological problem. So if you look at a study by Coy and Smith, they found that laser at liver 8, which is relevant to mood, in comparison to manual acupuncture at liver 8, is more associated with activating parts of the motor cortex, which is going to be better for rehabilitation, motor rehabilitation. So that's the key difference between utilizing those two techniques on the same point. Now, that brings me on to needle manipulation. So again, once you've put your needle in place, depending on what response you want, and that's going to also determine as to whether you're just going to needle into the skin and also whether you're going to needle deeper into the muscle. But we'll come on to depth in a short while. If I look at needle manipulation, I'm going to look back at when I first, not when I first qualified, once I got on to doing my masters. And while I was doing my masters, one of the main things that I actually did at that particular point was to go out and get myself a DVD, and it had over 100 different needling techniques. And I remember bringing it back, couldn't wait to get back. It was a conference I was at the time, and I couldn't wait to get back to have a look at this DVD, 100 different needling techniques. Anyway, all excited, sat down, started to play the DVD, and I must have got about 20, 25 different needling techniques in. I was quite disappointed by the time I got to my 2025 because it was showing me all these different needling techniques. It wasn't telling me the difference between this needling technique, effect wise, between applying this needling technique and the other needling technique. And that's pretty much what I was wanting to know. It was just showing me all these different needling techniques. I'm thinking, well, when would I use that one and when would I use the other one? So it wasn't until I was actually publishing my book, and that was one of the key areas that I focused my attention on, was what is the most effective needling technique for certain conditions, and depending on what you're actually treating. Now, what I did find from that is it boiled down to 3 different needling techniques. So regards to all these 100 different ones, there was only 3 needling techniques which was shown to be optimum. And that is going to be one of the key things, is when you're actually needling, that's what you want to be thinking, is what response do you actually want from your needling technique, as opposed to just putting the needle in and leaving. And that's going to, give you a better treatment outcome. So if you're looking at 3 main needling techniques, it's putting the needle in and just leaving it, putting the needle in and gently rotating it back and forth. Otherwise, you could put the needle in and it's like more piston. You're kind of gliding the needle up and down, or you can glide it up and down and rotate the needle at the same time. So they're the key needling techniques that were found to be, most effective, as opposed to ones that I was looking at where they were stroking the needle, flicking the needle, sliding the finger up and down the needle. There was all these different needling techniques, but no one was kind of saying, well, this is the effect I'm going to get from each of these needling techniques, and what each one was actually utilized for. However, Fang showed that rotating the needle elicited Dechi in Acupoint liver 3 and gallbladder 40. And they looked at the brain areas in which it was actually activating. So what they're basically finding, the stronger the needling technique, the more activation that they actually got in key brain areas, and the stronger the activation they actually got. So if you're looking at analgesic effect, that's where you need a stronger activation. If you're looking at enhancing muscle strength, again, that's where you're going to need a strong activation. But if you're looking at more psychological issues, then you're not needing a stronger activation to be dealing with those. You're wanting more of a parasympathetic response, as opposed to a sympathetic response. So therefore, the needling technique is going to be much, much gentler. So they're going to be key things that you do need to take into consideration. So if you look at Parker and colleague, demonstrated that the introduction of needle rotation significantly increased deep, dull, and heavy dechi sensation. Now, when I look at that, I always say it's the understanding, so to somebody who's not familiar with depth of needling, if you needle down to the muscle, then you're going to get a deep, dull ache and that heavy dechi sensation. Why? Because it's the C fibers that will give you that sensation, and they're located in the muscle. If you needle into the skin, which is going to be more of a parasympathetic response, you are not going to get that deep dull because you haven't got the C fibers that's going to give you that response. So to a certain extent, it depends on the depth in which the needle's actually gone in. Okay, so just to just highlight that, I'm hoping I'm not confusing anybody with that. So that's going to be partly due to the depth in which they've needled, as opposed to not as in combination with the rotation and manipulation of the actual needle. So another study found that deep needling with bidirectional rotation had a greater effect than deep needling without rotation or superficial needling, an increase in both dechi sensation and pain threshold. So that's just a taster on that one. Now, to obtain acupuncture analgesia, again, that's been recommended that you do need deep needling into the muscle with strong rotation, and that's regardless of whether you're doing electro or manual. And again, you are going to get a stronger dechi sensation if it's dechi that you're actually going to be referring to in regards to that. Whereas if you're needling into the skin, you're not going to get that dull ache because, as I was saying beforehand, it's more parasympathetic in regards to that. Now, as we come on to myofascial trigger points, you have two needling techniques that's mainly employed in treating myofascial trigger points. You've got what you call sparrow pecking. Those of you who's not familiarized with that, that's where you're just going to put the needle into place and just gently move the needle up and down. Otherwise, you've got what you call fanning. Fanning is where you're going to use a longer needle, and you're going to needle, in most cases, the fanning technique, you are actually aiming to get the nodule. And it's more like you're going at it with a pickaxe. Patient's going to find it quite uncomfortable. Now, overall, I've looked at a number of studies, and overall, with these studies, it's showing no significant difference between sparrow pecking and fanning. So I always say, why torture your patient with your fanning technique when your sparrow pecking is just as effective? And again, it depends as to, there are a lot of courses out there when it comes to dry needling and treating myofascial trigger points where they have the belief, which we'll get onto in a short while, they have the belief that the deeper your needle, the better the effect. However, you need to look at literature. There's no literature that is demonstrating, and when I say deep, the deep with regards to you need to needle all the way down to this so-called nodule. So you need to define what deep is. And if you look at any research, deep is about 2 centimeters in depth, not all the way down, which could be 3-4 centimeters, in which some people's going and needling right the way down to the desired muscle to have the effect. So it's more or less what you understand. So in other words, people are teaching that, but however, what I'm saying is it's not backed up by credible research, and that's what you basically need to look at. At the end of the day, it's keeping yourself safe and also keeping the patient safe at the same time. So again, if you look at other key studies, Palm compared the effects of sparrow pecking to the effects of fanning on active myofascial trigger points in the upper trapezius muscle in patients with neck pain due to trapezius myofascial trigger points. What they basically found was no significant difference with regards to decreased neck pain and disability, as well as increased pressure pain threshold in patients with neck pain due to myofascial trigger point syndrome. So that's one of the key papers there. There are other papers So that brings us on to the depth of actual needling. And I say it is important to take that into consideration. And particularly once you start to look at research, and I find in a lot of cases, shallow needling, which they are generally actually utilizing as sham needling. And I'm finding a lot of these researchers are not familiar with different countries and their needling technique, which they're classifying as sham. In my eyes, sham is supposed to be inert. It's not supposed to have an effect at all. But anyway, I always say if they're going to undertake research and they're going to define sham, they also need to define acupuncture. And if you look at the definition in any dictionary of acupuncture, it is penetrating the skin with a needle. So even a sham, if you're utilizing a sham and you insert it into a skin, it is going to have a physiological effect, regardless, and it will have an effect on pain if it's treating pain in the area in which you've actually inserted that needle, because it's going to have an effect on the myotome, dermatome, and if it goes down to the bone, it'll have an effect on the sclerotome as well, on pain. And most studies is based on pain. So the key thing is when it comes to depth of needling, what it's going to primarily depend on is the outcome and also the size of the actual patient, the condition in which also you're actually treating. Now, if you look at from a traditional Chinese, needling was differentiated based on depth of a particular disorder. So if you're looking at something acute, and also myofascial trigger point conditions being treated superficially with surface subcutaneous needling. Now, that was something that was demonstrated. So when I first started treating myofascial trigger points, I did used to go maybe 1 to 2 centimeters in depth. However, I remember when I was doing my master's in acupuncture and our lecturers took us in and we was treating the piriformis muscle, and she was demonstrating to say you do not have to go that deep. The loci to the trigger point sits on the surface, so therefore that is what you're treating. You don't have to go all the way down to the muscle to deactivate the actual trigger point. However, so what she basically demonstrated to us was, so she took a patient who had trigger point in the piriformis muscle, and what she basically did was put needle in no more than 30 seconds and left the needle, and the needle just penetrated the skin and barely went into the muscle itself. Left it for 30 seconds, took the needle out, palpated the point. If it was still active, then she just reinserted the needle, left it for another 30 seconds. She repeated that 3 times. Trigger point deactivated. So she was demonstrated clearly how effective that technique was. And I've used that numerous amount of times with my patients. And I found I do not have to needle that deeply, as many people do believe that that's how deep you need to go, much deeper in order to deactivate trigger points. Now, however, if you're looking at organ and bowel disorders in traditional Chinese, it is looking at needling down into the muscles. If you're looking at something more serious like genetic disorders, then that's where they'll needle down to the bone. Okay, so that's which is being more proposed by from a TCM perspective. So if we look at research in itself, research will define superficial needling as between 1 and 5 millimeters. However, if you look at Japanese style and some of your other Asian type needling is quite superficial, and that's only 1 to 5 millimeters. If you look at Japanese style acupuncture, sometimes the needle don't even stand up. They put the needle in and the needle actually flops. And that type of needling has been shown to be quite effective, and particularly if you're treating neurological disorders, you're going to find your Japanese style will outperform your Chinese, because your Chinese will needle deeper than your Japanese, anything between 1 centimeter to 2 centimeters in depth. And that's commonly what's going to be used, and also commonly what's going to be used to treat myofascial trigger points. So that's just something to bear in mind. But however, once you start to look at your 1 to 5 mil, a lot of your sham acupuncture is classified as 1 to 5 mil. And that's why you're finding a lot of cases there's no significant difference as what they classify as true acupuncture, where they're needling between 1 centimeters to 2 centimeters, and sham acupuncture, in which they're needling half a centimeter. At the end of the day, acupuncture is acupuncture. You penetrate the skin with that needle, that is acupuncture. At the end of the day, it's as simple as that. Now, if we're coming back to myofascial trigger points, now Carl Lewitt, these was one of the founders of acupuncture, and if you look back at the time, was a strong advocate of deep needling. And if you look at a lot of people who's advocating deep needling, it mainly harks back to Carl Lewitt, and particularly from the publication. But what I'm finding in a lot of cases is people's not taking the time to read the publication and look at the depth in which he was actually needling. So that's going to be quite important. So they've taken it a stage further and announced that you have to needle down into the muscle, in which case you don't need to do that in order to get the optimum effect. However, Baldry, a former student of Lewitt, first started needling deeply. However, it came to a point where he had a patient, and because of the condition in which the patient had, he wasn't able to needle as deeply, and therefore he did superficial needling on that patient, and he found that the effect was just as good as the deep needling. So since that point, Baldry has recommended superficial dry needling to a depth of 5 to 10 centimeters, and again, similar technique where he's going to put it in for 30 seconds, then he'd test. If it's not deactivated, he'd put it in for another 30 seconds and then test until the trigger point is actually deactivated. And that is what he then started to apply and advocate to his other students, and change from being deep needling to more superficial. And that same thing applied to myself when I look back as to when I did my master's and I was introduced to the superficial needling and finding that just as effective as the deep. So therefore, I couldn't see the point as going as deep as what I was initially shown, and I just advocate superficial. One, much safer for the patient, and two, again, it protects your health and your liability insurance and things like that, and it's not putting anybody at risk. So again, once you start to look at other studies, they have been shown to be no significant difference. However, this one, immediately after, no difference with regards to pain. However, what they basically did find in this case was deep, and deep was classified as 15 millimeters. So you're not going as deep as some people tend to go. But however, they did find a difference at 3-month follow-up. However, if you look at other studies, again, once they looked at 3 and 6-month follow-up, they found no significant difference between the superficial and the deep needling. There are other studies, but I'll be here all day if I'm going to start going through all of them. But as I said, the majority of them are finding no significant difference between the superficial and deep when it comes to the activation of myofascial trigger points. So that's just something to bear in mind. Any of yous out there that's treating primarily myofascial trigger points. And again, if you're treating primarily classical acupuncture points, again, you do not have to be going as deep. And again, if you look at any of the text, in most cases, your text is going as deep as 2 centimeters, but however, the majority of points is going to be round about 0.5 to 1 centimeter in depth. And that's where you're going to find the majority of points are going to actually lie. You don't need to go above and beyond in order to get the treatment outcome. Now, if you look at McPherson, these are, once you start to look at functional MRI, and again, they found no significant difference in functional MRI between deep needling and superficial. However, you found Zhang found more activation in almost all brain areas from deep needling. However, you got Wu found more activation from superficial needling in the somatosensory area, motor area, and language areas, and from deep needling, more deactivation in the limbic system. So you're getting mixed results with regards to that. Now, that leads us on to number and frequency of treatment sessions. Now, that's going to be quite important. And depending on how you actually approach your treatment with regards to how many treatment sessions. So let's say, for example, you have a patient, and they come in with a back problem. Now, if it's an acute back problem, I always say the closer that treatment session is, the better. So if you've got somebody in acute, and again, that was demonstrated with my wife with regards to number and frequency. If you can treat somebody on a daily basis, your overall effect is going to be even better. Where, I was going up to Newcastle to run a course, and she couldn't get out of bed purely because of her back. So we had 3 young boys at the time, and I had to treat her on a daily basis over 3 days in order to resolve her problem so I could go on my merry way. So, but however, if you have a patient with an acute back problem, I would say make sure you get them in at least twice a week. Now, even though you've got that twice a week, overall, your overall number of treatment is going to be a lot quicker, and you might not need as many treatment sessions by bringing those together. Particularly if they come in and they say after 3 days it was really good for 3 days and the problems start to come back. You need to hit them again with a treatment session before the 3 days, or on the 4th day. So therefore, you're going to find one session will then build on the next session, and therefore they'll get a better treatment outcome. And then eventually you can take it from the 2 days a week to a week, and then you can start to expand on that. So it all depends as to what the patient's presenting. And again, besides the treatment sessions, you can also lengthen the duration. So combine those two and you'll get a much better treatment outcome in regards to that. So if you look at systematic reviews and you look at the number of treatments, even though, once I start to look at some of these studies, I think, that might be a little bit too many treatments. I'd aim to resolve the problem much quicker than that. So if I look at a study by White and Associate, they recommended at least 6 treatment sessions, at least once per week, with at least 4 points needled for each painful knee. So that's looking at treating somebody with a chronic knee problem. Now, I can look at myself, and I can also look at other patients where they've given me a very short time period in order to resolve their problem. I was doing the Edinburgh Marathon. I'd actually run 26 miles local to myself in preparation for that, so I already knew I could do the distance. And also I was planning on doing it in 3.5 hours. So in that respect, I already knew I could do it within that time period, so therefore it wasn't going to be an issue. But 10 days before the actual event itself, no, it was 12 days before the event itself, I actually tore my calf muscle to the extent I couldn't walk. I couldn't even put my weight on it. Now, I spent the first 2 days sulking, just really cheesed off the fact that, I'd done all this training and I felt I'd done it for nothing. And, it was just going to be a complete waste of my time. So, yes, I was sulking big time. And, but however, it was just one of those, once I got onto the second day, it kind of just dawned on me to say, hold on a minute, Steve, I treat all these patients, very short time scale, and they've got events coming up and I managed to get them in. So there's any reason why I can't do myself. So I took my electroacupuncture unit home. I treated myself every day, and sometimes twice a day with the electroacupuncture unit. And I turned up on the day. I didn't know how far I was actually going to run. I didn't know whether I could do a mile, never mind 3 miles. And I managed to actually run the event. I mean, I could feel it, but I managed to get round in 3 hours and 54 minutes, which, with holding an injury, I thought that was quite impressive to say that on the day, I didn't even know whether I could, run the first mile, never mind a whole 26 miles in itself. So that is, to me, is the power of acupuncture, and utilizing more the right technique, the duration, and also the frequency, which allowed me to do that. I know that if I'd applied any other treatment modalities, I definitely wouldn't have actually made it to the actual event. So in other words, acupuncture is very effective if you choose the right points and you use it in the right manner in that respect. So if you look at this study, assess the effects of acupuncture as a treatment for chronic pain, and found that 6 or more sessions of acupuncture treatment were significantly more effective and associated with a positive outcome than 6 or fewer sessions. So you're generally finding, it is in and around that 6 mark that you actually finding. But however, once you start to look at back pain, now, if they looked at the number of back pain, they reported that 10 acupuncture sessions gained a better therapeutic effect than 5. Generally, if I'm treating somebody with back problem, I'd expect to have resolved the problem by 10 sessions. In most cases, I would expect to have resolved the problem, chronic or acute, by in around 6 sessions. And a lot of that is going to be down to the choice of points. I'm not going to get into treating the back as it stands at the moment because I've already done a previous presentation on the back. And what you basically find, even though these people are out there, expert in the field of treating backs, overall, when I looked at the choice of points in which they chose for the backs, in many cases, they didn't choose the most effective points. So if I look at something like small intestine 3, there was only something like, out of 35 studies, there's only something like 3 studies. No, in fact, there was 1 study that used small intestine 3. And that's a very powerful point for the spine and also relaxing off the muscle. If you're looking at yin tang, again, for acute or even chronic and relaxing off the muscles, very few studies utilize yin tang or even do 26. And that's just to name just a few. Now, what I also found, once you start to look at back, was urinary bladder 51. I didn't find 1 study utilize urinary bladder 51. And to me, that is a very potent point. And in most cases of a back problem, you need to be utilizing that point. And again, if you palpate that point, I can guarantee in 85% of cases, that point is going to be tender. And it will refer pain, similar to sciatic pain, that you're going to get. And it will activate a lot of your trigger points in your glutes. So therefore, it is a point that needs to be addressed. So therefore, as I was saying, is most of your treatment is also going to evolve around the right points. In other words, if you haven't chose those right from the outset, it doesn't matter, how many treatment sessions or how you're needling. Your whole treatment is going to take much longer depending on your choice of points. So I always emphasize your choice of points first, then everything else comes after. Now, coming on to the NICE guidelines. Now, this is before the NICE guidelines decided they were going to withdraw acupuncture for treating low back pain. But at that time, they advocated 10 sessions over a period of 12 weeks. So you're talking around about an average of 1 session per week. But as I said, I would expect if I'm treating somebody with a back problem, on average, I would expect 6 treatment sessions. That patient should be resolved and discharged. If you're not doing that within that time scale, you need to take a closer look at the choice of points in which you're choosing. So that's where that's actually going to boil down to. Now, again, if you look at Wang, identified 15 to 20, but these ones here are treating more psychological problems. So generally, I personally would expect if I'm treating somebody with a psychological input, whether it's part of your back pain or whether you're treating them for insomnia or depression, then yes, they are going to take more treatment sessions. But however, as you look at and colleagues, they didn't find that that sleep did not improve until the 8th session. Now, if I'm treating somebody for insomnia, if I do not see an improvement in my treatment within 2 to 3 sessions, I would look at changing what choice of points I've got. So to me, I would look at that study in particular to say, well, you need to address the points because that's why it's going to take 8 sessions before you're going to see an improvement. So that's going to be quite important. But, that's just pointing out. But normally what I tend to do if I'm treating somebody with a psychological input, then I'll utilize seeds or indwelling needles on the body, which they can go away and stimulate, or within the ear, which they can stimulate. So to a certain extent, you are increasing the frequency of the treatment and prolonging, you're getting the treatment over a longer time period as well. And I find that brings down the overall number of treatment and make it much shorter, and you get to your treatment goal that much quicker. So in other words, to a certain extent, you're giving some of that control to the patient. So how many needles should I use? So the number of needles, if you're going to use too many needles, then you can overstimulate. And I have had colleagues where, or students where they've got back to me and saying, Steve, I'm treating this patient. This is what the problem is. I always like patients to, my colleagues to actually, send me through what the treatment plan is or what they propose to do or what they have been doing. And I can advise how they can go about making changes. Now, it's when they've sent me an image, and I have had, I won't say who, but I'll say I have had images coming through. And what I've basically found on one of them, they literally blitzed the head and face, and it looked like Hellraiser. And more or less, I had to message that individual back to say, you're using far too many needles. And if anything, you can have an adverse effect as opposed to a positive effect. But at the same time, using too little needles can have a similar effect. You're not going to get a positive result. So you do need to use the right number of needles. But still, it also comes down to the points. You choose the most effective point for the condition in which you're going to be treating. Okay, so that's one of the main things I always say: choose the most effective point. Okay, so again, if you look at treatment wise, it has been shown that insufficient needles, only 2 needles can present with an insignificant effect, or you're getting a false negative effect, mainly because you haven't. And I've seen a number of studies where they've only used 1 needle and then say acupuncture is not effective. What you've got to bear in mind is, in a clinical setting, at no point are you going to utilize 1 needle. You normally use a combination of needles. So therefore, from a research setting, it's not going to reflect what you're going to do in clinic. So you do have to be careful with regards to that. Now, if I look at this study here, what they basically did was to compare the difference between 6 and 2 needles. Now, the overall importance of this study is the 2 needles they used is the eyes of the knees. And once you start to look at you treating more internal knee problems, you're going to find they are going to be 2 of the most effective points you can actually utilize. Now, let's say, for example, you've got somebody with a swollen knee, or it's quite a painful knee, then I would normally laser those points or get the patient to apply gentle pressure to it if it's something you can't needle. And I find that is still effective enough to get the treatment outcome in which you want. So here you found there was no significant difference between 6 and 2. But as I said, you need to look at the 2 points in which to choose. And again, when it comes to knee problems, these are going to be 2 of the most effective points you're actually going to use, as they will address more the internal aspects of the actual knee. Okay, so again, if you look at another study, undertook a study to compare the clinical efficiency of acupuncture using 5 and 11 needles. They did a follow-up study where they used 3, 5 and 11, and overall no significant difference was noted between each of the 3 groups. So again, I think the important thing here was the points in which was chose as opposed to the number of needles. And what I'm saying there is that is going to be more important as opposed to a number of needles. Don't choose a point purely because it's in the area in which the condition you're actually treating. As we were pointing out, if you're treating a back problem, your most effective point for the back isn't in the back. Your most effective point for the back is in your face, your hand, and your feet. And that's where you're going to get your optimum results. Whereas if you focus on putting points into the back, then it's going to take longer to resolve the problem. And that's, something very important you do need to take into consideration. So, and again, what is the desired effect? So in other words, besides treating, if you're not thinking about the desired effect, then again, that is going to have an effect on your treatment. So in other words, if something's acute, your needling approach is you want a parasympathetic response. In other words, it's a more of a gentle approach. Your needles can barely break the skin. So in other words, if it's acute, very painful, then you need to be needling slightly shallower. Your manipulation, if you're going to manipulate the needle, is going to be very gentle manipulation. Now you're going to get a better response. If it's chronic, then you can go deeper with the needle. And if you needle local to the area, again, you can go deeper and you can manipulate the needle that much stronger. Now you're going to get a sympathetic response. And if you're going into the muscle, that'll bring more blood to the area. In which case, if it's acute, you cannot do that. Otherwise, if you needle local to the area and you manipulate it strongly, one, you've gone into the muscle, so you're going to get a sympathetic response. The increase in blood to the area, it'll be a lot more blood than what you anticipate, and that is going to cause more swelling and cause more discomfort to the patient. So they're key things to bear in mind is, what kind of response you actually want. And also, as I was saying beforehand, is the placement of the needle. So to just give you a quick example, if we are treating more, let's say, for example, we're going to move away from musculoskeletal and we're going to look at treating more something on the visceral side. So if you want to increase stomach motility, think about the fight or flight. So sympathetic brings more blood to the area. Parasympathetic, well, should I rephrase that? If it's your stomach, that's more to the muscle. If it's the stomach, sympathetic is going to bring less blood to the area and make the stomach less active. Whereas your parasympathetic will bring more blood to the area and also make the stomach more active. So depending on where you place that needle, is if you place it onto the torso, you're going to get a sympathetic response. So in other words, if you're going to utilize points such as urinary bladder 20, urinary bladder 22, you're going to get a sympathetic response to the stomach. That's going to reduce the activity of the stomach. However, if you use something like stomach 36, that's going to increase the motility of the stomach and bring more blood to the stomach and make the stomach more active. Same applies to if you're going to utilize and treat the heart. If you use something like pericardium 6, heart 7, that is going to have a parasympathetic effect on the heart. So therefore, it's going to bring the heart rate down or calm the heart. Whereas if I'm going to prepare an athlete for activity and I want to improve the heart and lung capacity, I would utilize something like urinary bladder 13, urinary bladder 14. Now that is going to have, or I need to utilize something like lung 1, lung 2. Now that is going to increase the bronchioles, the size, and open that up and allow people to breathe a lot deeper and prep them more for sporting activity in that respect. So it's what you actually want, and it's more the placement of the needle. So I won't be placing it down into the arm, otherwise I'm going to get a parasympathetic and it's going to have a reverse effect. So even though both will have an effect on that organ, one will have a sympathetic, the other one will have a parasympathetic. So it's just how you look at it and how you think about it. So as I was saying with regards to distal points, it is important at all time think about distal points. Many studies have compared the difference between distal points and local points. And you will find in 99% of cases, your distal points has outperformed local points. So if you're treating something MSK wise and you're treating something like the neck and shoulder, your distal points, again, something like your Sanjiao 5, that has been shown to be more effective. And also your gallbladder 34 has been shown to be more effective at treating shoulder problems than actually putting points directly into the shoulder. Same again with low back pain. Gallbladder 34, urinary bladder 40 has been shown to be more effective. And same again, once you start to look at your small intestine point, small intestine 3, these points have been shown to be more effective at treating backs distally than your local points. So it is important to think about distal points as opposed to just thinking about points immediately around the area in which you're treating. So that's why I always say think about your most effective point for that condition, and it's not always in a locality as to what you're actually treating. So just something to bear in mind. So these are just some of the studies where they have compared distal points, and you're finding your distal points have fared better than your local points. Okay, so again, the surrounded dragon technique. So going back to when I did my marathon and got the muscle tear, this is a technique in which I used on myself. Here, the image that I have here is on one of my athletes. He is, well, he isn't now. He was on the British squad. He was a duathlon. And he was one that I used to utilise a lot of my acupuncture to enhance sports performance, and managed to get him onto the British squad for enhancing his performance, which he had been trying to get on there for a good 2, 3 years and not managed to get on there until I managed to stick a few needles in him and managed to get him onto the actual squad. But however, here he turned up with an injury prior to one of his events, which he was having abroad. I think it was Spain. He was actually the event was, and I can't remember the time scale, but I know it was a very short time scale. I had to get him sorted out in preparation for the event. And this is where I'm utilizing the electroacupuncture, the surrounded dragon technique. So what I'm saying is, if you're not utilizing the surrounded dragon technique, it's something you need to consider. Now, there are many, many studies out there. Once you start to look at ulcers, non-healing ulcers, there's a lot of studies utilizing the surrounded dragon technique. Not all cases are actually using electro, but what you're basically finding is it enhances the laying down of your type 2 collagen. It also enhances the strength of the actual wound itself, and also the contracture around the wound allows it to close up that much quicker. So if you look at the studies in which they've actually done that, same again, it reduces the inflammation, and it encourages pro-anti-inflammatory. So it changes the inflammatory cytokines such as your interleukin 1, and it allows more of your pro-anti-inflammatory cytokines, such as your interleukin 4 and also your interleukin 10 to actually come into place, therefore reducing the inflammatory and enhancing the actual healing process. So that's going to be, once you start to look at that, they are quite important with regards to your tumor necrotic factor and things like that. So I hope I didn't take up too much of your time there, but however, thank you for listening.